Hi, this is Dr. Paul of the Dr. Paul Show. Today I'm going to talk about self-medicating. What does that mean? But before I get into it, please press like and subscribe to make sure you're getting the most up-to-date information and material. So today I want to talk about self-medicating. This is a topic that I see very, very frequently. I'm basically talking about drug use, alcohol, and you know, there's a lot of people out there that can social drink. I mean, I like beer. I don't overdo it. I do a little on the weekends. But you know, in the case of alcohol, some people take it too far. Sometimes instead of a glass of wine, it becomes a bottle of wine every night. Instead of a couple beers, it becomes 6 to 10 every day, and not just a weekend, then every day. So, and then there's other harder drugs. There's a lot of opiate use out there, from opiate pills like, you know, pain pills, and to the street version, which like heroin and fentanyl. Very dangerous. Fentanyl is one of the #1 killers of young people in our society. And there's methamphetamines. There's cocaine, there's marijuana. So why do people, when I say self-medicate, what does that mean? Well, again, when people are doing drugs, they want to feel better. That's the point of doing them. They want to feel a certain state of being. So when people are anxious, what do? When people have anxiety, they drink. You know, because people know that, you know, when you go out and to meet people, if people have, let's say, social anxiety, and they go out to a bar and they want to meet someone, you know, after 2 or 3 drinks, they feel better. They feel more relaxed. That's what we call liquid courage. And then they can talk to people easier. And then if someone feels anxious, they may smoke marijuana. Now, some people can do it here and there, occasionally here and there, and then some people do it all day, every day. And there's a lot of other things like tranquilizers. Some people will get, you know, on the street, they'll get Xanax, they'll get Klonopin or Ativan and use those and then overdo it. All those things are to self-medicate anxiety. Let's say someone's depressed. What do? Well, sometimes they'll do uppers. They'll do methamphetamine. They'll do cocaine. And so, you know, other forms of speed. You know, some people do mega doses of caffeine, lots of power drinks. So when someone wants to get to a state of being, they can use substances in order to do that. The problem can become is addiction, and you know, some people get to the point where they have to do certain drugs in order to stay in that state, and that's what happens. And the #1 killer statistically is alcohol. #2 is fentanyl, by the way, and people hear about fentanyl because it's killing so many people. Ever since it took over, now it's really actually hard to find heroin anymore, because fentanyl is just has flooded the streets. Basically, China sends it to Mexico, the ingredients, and the cartels basically have been able to get it through the open border, the last administration, quite easily through the border. Now it's more difficult, people can do it in labs. You know, people have their own laboratories where they can make it. But since fentanyl's been around, it's really hard to find heroin anymore. So these are very dangerous drugs. And the problem with opiates is they're extremely addictive and very, very difficult to get off of. And so when people go into, let's say rehab, if they get to that state, hopefully they don't die from it, then if they stop the addiction, well, now you have to replace it with something. So then we have to get to the point, why did the person fall into that addiction in the first place? Well, usually there's an underlying mood disorder. There almost always is. There's a term called dual diagnosis in this field of medicine. Dual diagnosis means you have an addiction, but you also have a mood disorder. I've always thought that the term is pretty ridiculous, because anyone who has an addiction issue is pretty much almost 100% of the time has an underlying mood disorder. Now, there's some people who get sober, let's say, in AA, and let's say they don't treat any mood disorder, but then they switch to a different addiction. They switch to gambling. They switch to smoking. I mean, nicotine is again a huge addiction, and probably one of, if not the most difficult one to stop. But a lot of people at AA are smoking cigarettes. A lot of people they're doing power drinks. They're gambling. They develop sexual addictions. So there's a lot of we call cross addiction. So sometimes people beat one addiction, they switch to another addiction. And like I said, marijuana is now it's legalized in a lot of states, including California, so it's very easy to get. And again, some people can do it here and there, and not fall into a pattern where it gets more and more. But like I said, some people use it as their medication, and when you ask them why are you doing it all morning, and they say, well, that's because I have my anxiety. They'll tell me. They say, well, it's the only thing that works for my anxiety. And when I say to them, well, I can help your anxiety in another way, and some of them are very hesitant. They go, no, this works for me. I go, yeah, it works for you, but we're not fixing the problem. I call it band-aiding a problem. We throw something like a band-aid on a wound. And I use the example, I say, if you had like an abscess on your arm or in your leg, and there's like pus coming out of it, and you squeeze the pus out, you put a Band-Aid on it, you put a little bit of antibiotic ointment on it, you put a Band-Aid on it, and you keep doing that every day, and then someone would look at that and say, well, why don't you take an antibiotic? That you might want to get that fixed. And no, this works for me because I just squeezed the pus out and I put some other Band-Aid on. So basically, with topical treatments, like just, for example, Xanax, Xanax is, again, very helpful for panic attacks. I do prescribe it in appropriate cases, but it can be overdone because people use it as their primary medication, and it's very difficult sometimes to get people to try to take something preventative because people say, no, this works for me. I don't want to take anything else, or I don't want to take a daily medication. And I say, well, you're already taking a daily medication. You're taking this. Well, this is different because this helps me. So sometimes it's very difficult for some people to convince them to treat what they have. Sometimes I have to tell them I'm going to have to take you off of this if you don't, and unfortunately they don't like that. But I tell them, I don't want to keep just giving you a Band-Aid. I want to fix your problem here. And some people leave and they don't come back to see me, and I wish them the best, but I'm here to try to fix the problem. And so what I try to do is figure out, do they have an anxiety problem? Do they have depression? Do they have bipolar disorder? Or do they have ADD? Now, for example, some people treat their ADD with methamphetamines. And they say they feel great on meth, and they say I feel calm, I feel relaxed. Well, that's because they're taking speed, and I say, well, look, if this is a bit controversial with someone who has an addiction to methamphetamines, but let's try you on an ADD medication, which is a stimulant, but it's much safer. And it's actually fixing the problem. It's actually treating the problem, not just, again, throwing a Band-Aid on the problem. And I have had a lot of patients who say, I'm great. As long as I take this, I have no desire to take the street stuff, which is great. That's a win. That's a big win right there. And then sometimes if you're not sure, you can drug test them to make sure they're staying on the program. So with me, when I see anyone with an addiction problem, I have to really, like I say, get under the hood and really try to figure out what's going on. And that means taking a really good history from the patient, trying to figure out what happened, what led to this. And again, if I treat the condition properly, then the addictions can really just go away. I see it all the time. And a lot of people who are alcoholics, they can get, the ideal is they don't drink anymore, but some people have gotten to the point where they can just have a drink here and there. Again, if you go to AA, that they're going to tell you no. Some people can do that and get away with it and be okay. Some people can do that, but it leads them right back to where they were. So it's very individualized what I'm talking about. So when I treat someone with addiction, it's very individualized. Again, the approach to it. And if you want to learn more about this, I have a whole chapter on addiction in my new book, The Corona Protocol. Actually, the subtitle is a scientifically proven medical solution to stop addiction, bullying, homelessness, school shooting, and suicide. So I have a whole chapter on addiction and the treatment of that. And so if you want to get my book and read more about it in there. So anyways, but thank you for watching this. If you like what you saw, please share it with your family and friends. And if you want to have any questions, you want to make any comments, I answer every question and comment. So please get a hold of me, and I look forward to hearing from you.